name's Antonio with Enhanced Movements, Boulder County's premier chiropractic pain and injury consultant. This is Movement Mondays. Today we're talking about stability and mobility, okay? Now, to start off with, we have to indicate that any joint within our body needs both of these, right? If you have an injury, let's say like a ruptured ACL or something like that, that is going to make the knee less stable because we're missing some of the stabilizing ligaments and structures within the knee. That being said, if we've had surgery in the past or maybe chronic injuries or anything like that where we see a bunch of scar tissue built up, we're going to see a lack of mobility within certain joints, and that is going to in turn change how the joint functions. So if we look at that kind of relationship, we can see the importance on both sides. We don't want to just focus on one side or the other. Oftentimes, this seems to be the priority for people, not understanding that sometimes let me back up. Mobility seems to be the priority for a lot of people, not knowing that a lack of stability might actually be decreasing the amount of mobility that you can show. An example would be here in Boulder, Colorado. A lot of the patients that we see are super active, and we're going to use a rock climber or someone who's doing CrossFit as an example. They feel that their shoulder is tight and that they don't have the same mobility or range of motion that they should have. Upon our evaluation, we actually see a lack of stability within the shoulder blade, which would then prevent the amount of expression of range of motion that the actual glenohumeral or ball and socket shoulder can show. So the fix is not stretching the shoulder more, the fix is actually working on the stability of the shoulder blade, which is the platform off which the shoulder actually moves. Okay, so stability, I think, oftentimes gets way overlooked as far as a factor that needs to be addressed. Okay, now we're going to look at our little guy over here, and we're going to talk about regional interdependence, a term that was coined to show the relationships of the body and which joints inherently should be more mobile and should be more stable. In our example, we already covered part of that. Shoulder blades inherently, just by function, should be more stable to express the mobility of the actual glenohumeral joint or the shoulder. Now, as I was saying that, I wanted to also reminded myself of something else I wanted to describe, is that we need to have stability through range of motion. Stability oftentimes is looked at as being like tight or restricted. Stability, though, should be control, especially through range of motion. So in our same example, we were talking about the shoulder blade and the shoulder blade in relationship to the glenohumeral joint or the shoulder is, if you watch me raise my hand up over my head here, you can see how that shoulder blade is actually moving out and up. So when we're talking about stability, it's not just simply pulling back and down for the shoulder blades. I need to be able to have control through that full range of motion. Okay, so looking at our diagram here, we're going to look at the ankle. Okay, we're going to start all the way down from the floor. And again, we're covering just kind of like the broad terms here, just so you can see how these relationships play. Okay, so the ankle should be relatively more mobile. If you stand on one foot, right, and you can even kind of like make it a little bit more challenging for yourself, what do you feel happening to your foot and your ankle? Should be doing this. It needs to be able to mobilize and move to keep us balanced. Now, the knee on the other side is going to be more stable. There's not a lot. You have some twisting motion in the knee, but it's mostly going to be like flexion extension, right? And there's a little bit of lateral movement, but it's fairly limited. Now, the hip, right? Big greasy ball and socket joint. That should be able to express a lot more range of motion. Pairing that up with, though, the low back. Now, that gets into a lot of different conversations, but the low back, while it does have the ability to move, when doing certain things, we see that as relatively more stable because that's kind of a platform of our torso and our core in which our appendages then push off of. Okay? Now, that being said, the mid-back is going to be a little bit more mobile. Again, us being humans and using our arms to be able to pull, to grab, and push, that's translated through our mid-back and our upper part of our torso, so we need some more movement there. The kind of lower neck portion and upper back area is going to be more stable because that's what the head is attached to, right? So we need like a platform here. But then the cervical spine of the neck is going to be more mobile, right? Our neck can move a lot of different, neck and our head can move a lot of different directions. Now, pairing that off of, we have the shoulder blade, excuse me, which again is stable, right? We already talked about that. Stable through motion. The glenohumeral joint, the actual ball and socket, we know that has a ton of mobility. Elbow, like the knee, a little bit more stable. And then obviously our wrists have a lot of different range of motions and functions that we can perform with that. So the point is to see these alternating patterns, right? It's kind of like stable, mobile. Each one of those feeds off of the other. It's not that one is more important than the other, but we need to address this as a system rather than simply just looking at one area and determining that it is either unstable or not mobile enough, and that would then be the fix. We have to look a little bit more globally, right? It's the reason why if we have an ankle issue, we might see how there's a decrease in actual shoulder flexibility depending on what activity, right? It might be a squat. If my ankles are not mobile and I'm going down and that's preventing how much torso lean or position I have, that's gonna translate into what looks like a change in my shoulder range of motion, even though that might be fine. So, rough example, showing the relationship. If you feel like you've kind of been struggling with not knowing like what to stretch or what to do or what area to tackle first, this would be a prime opportunity to reach out to someone and to have a conversation about this to determine what might be more effective for you, okay? In our mind, you got to look at you got to look at all parts to determine the best course of action rather than just simply hitting the area that you feel is wrong or that you're having potentially symptoms at. So thanks for tuning in, guys. Once again, my name is Antonio. This is Enhanced Movements. We love that you guys are joining us for these Movement Mondays. Feel free to share it with anyone that you think might benefit from this. And we hope that this can apply to your life and create some positive changes for you too. We'll see you next Monday, and thanks again.